Hello guys, my name is Gabby Gerbel and welcome to my clinical case study. The learning objectives of my presentation are students will be able to understand the importance of multidisciplinary approach to determine appropriate placement for a client. Students will be able to understand the importance of using a variety of assessments to provide the client with an accurate diagnosis, and students will be able to recognize the potential bias of standardized assessments. My current placement is Franklin Elementary School. It's located in Belleville, Illinois. The population consists of mainly minority students, as 66% are considered minority students. In addition to that, 77% of our students are considered economically disadvantaged. The most common communication diagnoses that I see are speech impairment, language impairment, and fluency disorder. In addition to that, other diagnoses that I see are ADHD, autism spectrum disorder, developmental delay, and specific learning disability. So the client I will be presenting on today, I will be referring to him as KE throughout my presentation. He is a third grade student who is 9 years old. He often speaks in a high-pitched voice. His primary eligibility was developmental delay. He currently receives special education resource services in core English/language arts, math support, and speech and language therapy. Some things about him are he enjoys basketball, spending time with family, watching movies, and gravitates towards adults at school. So our IEP team for KE consists of his third grade teacher, the special education teacher, the school psychologist, the speech therapist, the occupational therapist, the principal, and his parents. So the reason he was referred was because his re-evaluation of his annual IEP was due for the year. So we looked at his educational needs, abilities, and/or learning difficulties. Have they changed since his previous evaluations from his previous IEP? So again, he is currently eligible under developmental delay. And this year we have seen that he continues to demonstrate difficulties in the areas of academics, communication, thinking skills, as well as social, emotional, and behavioral/functional performance. Throughout the school year, his social and emotional concerns have heightened from his general education teacher. He is not interacting with his peers. He's not understanding the conversation or the jokes that are happening in the classroom. Again, he gravitates mainly towards adults, and he is just lacking in that social area at school. So the school psychologist performed a variety of assessments. She started with a classroom observation. She administered the behavioral assessment system for children. She completed an autism spectrum rating scale. In addition to her completing this, the general education teacher completed it, his special education teacher completed it, as well as his parents. And based on the results of this scale, the team decided to refer him for an ADOS, which stands for the Autism Diagnostic Observational Schedule. And so I will talk about that a little later in my presentation. She also completed the Welshers Intelligence Scale for Children, the Welshers Individual Achievement Test, and a comprehensive test of phonological processing. So those tests just looks at different areas such as reading and math and just general cognitive abilities. The special education teacher's input was that she has concerns of his adaptive skills, as he often seems confused and gives up when tasks become difficult. He has difficulty complimenting others, making decisions, he lacks creativity, and he has trouble working with others efficiently. He requires multiple redirections, and he is again heavily reliant on adult support if he is working in a small group and his special education teacher is not directly at him. He often will break down, not participate, and just kind of be off in his own little world. He does not seek out other peers again, but will engage with them when asked. Something to note is that he has been at Franklin since kindergarten, and at Franklin there is only one class per grade level, so he has been surrounded by the same peers for his whole schooling experience for the most part. And another thing she noted is that he often seeks out sensory input. He is always rubbing something in his hands in between his paper. I've seen him be little pieces of paper, receipts. He'll pick up things from the floor. He'll take in rocks from the playground. Another thing he often does is he will rub against the teacher. He likes to rub his body up against a teacher's arms or seek some sort of hug, but he always wants to be close to an adult in their personal space. So a little bit more about the ADOS. It is a semi-structured standardized assessment of communication, social interaction, play/imaginative use of materials, and restricted and repetitive behaviors. KE was administered Module 3, which was designed for children and adolescents who fall within the range of later preschool years through 15 years of age who have fluent language skills. Two administrators must be in the room when the ADOS is being administered, and you must be trained in the ADOS. It does not have to be a school psychologist, as speech therapists can also administer the ADOS. So the ADOS looks at a lot of different areas, which includes construction tasks, make-believe play, joint interactive play, demonstration tasks, describing a picture, telling a story from a book, cartoons, conversations and reporting, emotions, social difficulties, and annoyance. And then the kids get a break, but they do not leave the room. They stay in the room. And so during that time, the administrators will observe what he does unprompted. They ask questions about friends, relationships, and marriage, loneliness, and he has to create a story. So some things to note, during the ADOS, KE separated easily from dad. He did come to a new unfamiliar building and was put in a room with the school psychologist who he is familiar with and another psychologist who he was not familiar with. Our school psychologist did the note taking during the test, and the unfamiliar psychologist did most of the administration. He was very compliant during testing. Something very odd that he did during testing that he does not do at school nor at home is he was very active in the room. He was laying on the table, lying on the side, hanging onto the table, stroking the table. He does not do that at school, so that was an odd behavior of him. He was shifting in and out of his seat, and he would fidget while asked to sit. He did not engage in spontaneous conversation. He would repeat phrases, "come on," and throughout the assessment, which we hear the phrase "come on" at school a lot. He wanted to engage with the toys that were put away, but during time for play with the toys, he was often violent, recreating YouTube videos that he watched. So it wasn't his own imaginative play, it was him recreating things he saw, which we noted. And he often had difficulty with verbal tasks, and he responded frequently with, "I don't know." And he would become very upset and frustrated during these types of questions. And the types of questions they ask pertain to relationships, routines, or his experiences. He initiated and maintained appropriate eye contact during testing. He had limited facial expression. Again, he only demonstrated extreme pleasure or he was upset, and he did not understand social boundaries. Again, he was touching the other psychologist. He was rubbing up against her arm. He was, putting toys at her, hugging her. And this was a new person who we'd never met before. So again, social boundaries and personal space is something that he does not understand. So the results of his testing were that he did fall within the moderate level of autism spectrum related symptoms when compared to children who have ASD and are of the same chronological age and language level. So now I wanted to discuss some biases during the ADOS testing. Some of the questions included vacations, typical routine, family life, peer interactions at school. So as I stated before, most of the population at Franklin is economically disadvantaged. So many of my students have never been on a vacation before. KE became very upset during this question, and the psychologist did not understand why. And she just kept asking him, well, of course you've been on a vacation before. And he would say, no, I haven't. And she just kept pushing him. And she really didn't understand that, some kids have not been on a vacation before. So that was definitely difficult to see. Another part of testing where we saw bias was during typical routine and family life. Something to know about KE's personal life is that his parents are currently separated right now. And so he has come to school upset, trying to deal with the emotions that come with that. And during the typical routine, asking about family life, she would ask questions like, oh, mom and dad pick you up from school. Who helps you with homework? Don't you do homework and then you have dinner together and you enjoy times with friends and family and then you go to school? But the reality for most of the students at Franklin is that is not their typical routine. Most often they are with a foster family or they only have one parent in the picture. Another question she asked that upset him was asking about his grandparents, and she phrased, well, doesn't grandma spoil you? You have to be spoiled by someone in your life. And again, that is not the reality of most of my students at my school. And another thing to know is one of the categories, it was a picture of a pool, kids playing at the beach. And he said, I've never been to the beach. I see they're swimming, but that's all I can tell you. And she was like, oh, well, you need to tell me more about this. And again, he got very upset. During peer interactions at school, something to know is he did say he was friends with everyone and then started to talk more about teachers in terms of emotion. And so the biases that me and my CIs are during the ADOS, what I really want you guys to take from my presentation, or one of the things, is it's important to understand the life of the student outside school, what their experiences are and what they haven't experienced, and be sensitive to that. And maybe during testing, if they don't know and they're becoming upset, it's a reason that they don't know, and we should never make assumptions about any types of students. So in terms of testing that I did, I tested KE over 4 different sessions. I gave him the clinical evaluation of language fundamentals, or the SELF, the language processing test, or the LPT3. The LPT3 tests the ability to attach meaning to auditory stimuli. Subtests are arranged in order from simple to increasingly more complex processing tasks. And I also administered the Montgomery Assessment of Vocabulary Acquisition, or the MAVA. And the MAVA evaluates a child's knowledge on basic tier 1, high frequency tier 2, and curriculum-based tier 3 words, both on the expressive and receptive level. So the results of the SELF are here. His core language score, which is considered his general language ability, he scored a 62. The receptive language index, his score was a 69. His expressive language index was a 65. The language context index, which is his vocabulary and word knowledge, he scored a 76. And the last score is the language memory index. He scored a 68. So that probes memory and dependent language tasks. So again, standard scores we look to be between 85 and 115, and most of these scores fall 2 standard deviations below the mean, showing that KE really struggles in the area of language. Something to note during testing is he is very aware of when things become difficult for him and when he's not performing well. So he often becomes frustrated and shuts down. He would put his head in the table. I would ask him questions and he would mumble answers. And I would ask him to speak in a louder voice, a voice I can understand him. And he just got upset. He wanted to see the scores he was getting, but then he would become upset when he didn't get a score of 1, he received a 0. He would ask, that was a good answer. Why didn't you give that to me? And obviously when you're giving an assessment, you can't answer this type of questions to give the student the answer because you need to see how they perform. But something to note is just the heightened emotions that he had during testing and how the scores really did show that. So on the LPT-3 results, he did a lot better. He received a standard score of 101. Again, you look at the areas of difficulty for him included categorizations. His previous goals were on similarities and differences, so he did really well there. Associations was well on here, and that is one of his goals we created just because he has not done well in other areas, like on the self and the association, he did not do well. Multiple meanings, so he got a score of 101 on this test, which shows when he's focused, when he's on, he can really succeed. So the last test results are the MAVA. He received a standard score of 107 on the receptive subtest and a standard score of 83 on the expressive subtest. So again, that 83 is just slightly below the average range, and that score of 107 falls within the average range. The MAVA just tests vocabulary, so you're showing the kids a picture book saying, show me the submarine, point to the flower, and then on the expressive side, what is this, what is this? And you just go until you hit the ceiling. So after we tested KE, the team was torn on where to send him for 4th grade. The general education teacher did not feel that she could support him in the classroom as the academics were getting harder. And again, as we grow, the stress that comes with that social emotional piece, she did not feel that he would be successful. The school psychologist, based on the ADOS testing and everything, she considered his autism to be a big part of where she thought she should send him. So they were more on the side of sending him to a self-contained classroom or a cross-cat classroom. And his special education teacher and my CI, who is the speech therapist, they thought that they could support KE at least another year in Franklin. There's only one special education teacher in the building, so she has served him for many years, as well as my CI. And they have seen him grow throughout the years, so they believed that with more academic support that they could both help him succeed. So based on since no one could come to an agreement of where to send him, the team reached out to the special education teacher as well as a behavioral specialist, and they followed KE throughout his school day. And what they said is that he has really learned helplessness. He knows he wants to seek out that adult attention. He wants to have one-on-one attention. So oftentimes it's not his ability to do it, it's his willingness to want to do it. So we're kind of shifting to give him, really push him in areas, maybe not do preferred tasks, and help him work through when he has those breakdowns. So the goals we came up with based on the results of the self are, his overall goal is that he will improve overall language skills as measured by the following objectives. KE will answer comprehension questions related to story, grammar elements, inferencing, and predictions during structured therapy activities. KE will compare and contrast 2 target vocabulary words to increase his understanding of word relationships during structured therapy task. His third goal is, when given a target vocabulary word, KE will state 2 meanings to a multiple meaning vocabulary word during structured therapy activity. And his 4th goal is that he will independently state 3-word association with a target vocabulary word. So the structure of the therapy sessions are, he receives 140 monthly minutes. He's seen twice a week for 30-minute sessions. Once a week, he comes independently, so gets one-on-one time. And the second time, he comes with another student or 2 students. Again, his variable performance is depending on his mood and the activities done therapy. If it's a preferred task, he will perform well. If it's a not performed task, we often see the behaviors of shutting down and mumbling. So in terms of his goal, answering comprehension questions related to story, grammar elements, inferencing, and predictions during a structured therapy activities. Typical activities include reading a story, The kids really like stories about a bear named Bruce, so we often read stories about that. Some things we also do are comic predictions. So what those look like are, it'll be a comic strip of different pictures with no words, and they will have to predict what happened in the story based on the pictures. And then I will read them what happened. We'll look at what they predicted, what the outcome was, and then we'll answer some comprehension questions about that activity. I will read them stories. They will do with guided worksheets during questions. And something that we really like to do is a game called Telltales. It is a game that has many different pictures, and you give the student 4 cards, so a setting, a character, something silly, and something to climax the story. So these students have to look at their pictures and make sure, give a story that's comprehensive. So does it have a setting? Where are the characters? What was the climax? What was the solution? So that's something that allows their creativity to come out, which is an area that KE needs to work on, and it's a preferred task activity. So that's a time where he can be creative. How this activity also helps him is that if another student is telling a tale, or if I tell the tale, it challenges him to understand why I chose what I did. And then we'll engage in that conversation and kind of help him socially that way. The way that my school reports data is taken every quarter. So the first quarter, the second quarter, the third quarter, and the fourth quarter. And our last data taken was on March 14th, and he received a score of 70% accuracy. So he's doing well on this activity. I, again, think it has a lot to do with, we try to choose activities that are of interest to him. And when he has activities of interest, he performs better. So the second goal is that he will compare and contrast 2 target vocabulary words to increase his understanding of word relationships during structured therapy tasks. So again, typical activities include worksheets, drills during gameplay. So we'll often play games, board games like Sorry, Trouble, Candyland. And what we like to do is I give him, again, just the 2 target vocabulary words, and we compare and contrast them. We'll use worksheets of the circles. Sometimes I let the kids write on the table, just trying to get them engaged. If he needs help, I will give him a visual prompt of what the items look like, and then ask him to describe the characteristics of the items to me. And another way I interpret this goal is through, if we're reading a story, we might see if 2 words are similar on a page, we might say, hey, how does this? This is a goal that is harder for KE. He received a score of 50% accuracy on the last data day. So again, in terms of goal 3, multiple meaning words, this goal includes a lot of worksheets so that he has the visual cue of what both look like, because he really struggles and gets frustrated when I tell him just the verbal cue and he has to engage in conversation with me. So a visual cue really helps him on these types of activities. Sometimes we do crafts where he can see the things, and then the other week we made a bunny and his words were the chains. And again, 60% accuracy on the last data day. So the fourth goal is 3 word associated with a target vocabulary word. So the example is water, and then glass, drinking, cold. Again, the same kind of activities for this goal. He received 70% accuracy during the last data day, which is great. He's really understanding this goal. A lot of my activities are the same across therapy sessions, as I can target multiple goals within the same activities. If we're working on associated goal and there's water, and the next one could be food, we could compare and contrast. Okay, how is water and pizza different? How are they the same? And so I try to target multiple goals during sessions to help him, especially during book readings. You can incorporate a lot of different goals during stories. It also depends on if he's alone or if he's with another student. He and the other student like to compete. They like to see who can get more answers right, and the other student has behavioral problems of his own. So that challenges KE to respond in a way that he has to keep his behaviors under control as well. And yeah. So the summary of my case study is my client is a 9-year-old boy recently diagnosed with autism. His performance is dependent on his mood and his willingness to complete his task. Overall, I want you guys to understand that relationships are vital for progress. When you are dealing with behaviors in kids who come from lower socioeconomic status, you need to have a relationship with them. So when they may become upset or they're not performing as well or they're acting out, that they feel comfortable enough to talk to you so you can get to the root of the problem. And again, I do not make any assumptions about what a normal family life looks like, what a normal summer looks like for these kids, because most of these kids do not fall into that mold. And if you make that assumption against them, it will put you back when working with them. So again, understanding the population you serve and what their life looks like outside of school, this will help you understand their responses in therapy and help you avoid bias yourself, and always advocate for your students as part of the multidisciplinary team. During the ADOS scoring, me and my CI were saying, well, you know, we don't see this, and we talked about the vacation and the typical family life. So just always be there for your students, you know them best. And yeah, thank you for listening, and I will see you guys on Friday. Bye.